The voices of loved ones, an environment rich with sound. As you prepare for the birth of your baby, or babies if you're having a multiple birth, prenatal care visits, childbirth classes, and hospital tours are times to gather information and become familiar with community resources, parent support groups, and various hospital programs such as how your baby's hearing can be screened. Barbara McKeever, a registered nurse and prepared childbirth educator, comments on the development of a baby's senses.
What we see is couples coming into class very eager to learn about themselves, what's happening to them, and what's happening to their baby. I tell them this is the time that's really exciting because now all the anatomy is there and he's starting to learn skills that are going to stand him in good stead when he's born. So he's learning to suck his thumb. He can drink. He can swallow. He's making breathing motions. He can see light and dark. He can taste. He can smell. He's in a fluid environment right now that has a certain odor to it. And when he's first born, that odor will be on his body. But it also happens to match an odor that is secreted by the lubricating glands of the breast and helps him find the breast for his first nursing. So all these skills are there. So it's the same with their hearing. The baby in utero can hear. And we've seen babies whose parents, obviously the baby knows his mother's voice, and he's accustomed to the sound of her heartbeat. Most babies in utero like the rhythms of rocking, not hard rock, but the rocking motion, that 1-2 rocking motion. So if you think of normal lullabies, rock-a-bye baby, it's this rocking motion, Brahms' lullaby. They like classical music. So you play tapes like that in utero where your baby can hear it. After the baby's born, he'll respond to that same music.
Following birth, your baby will continue to use all of the senses, including touch, sight, and sound, to experience and respond to a new world. One of the first ways that we communicate is by looking at each other. A newborn with normal vision sees best at a distance of 8 to 10 inches, the same distance from which your baby looks at your face when being held for a feeding. During a feeding, your baby experiences the warmth of your body, the comfort of being fed, and through sucking, starts to develop muscles that are needed for talking. As communication develops, it becomes a process of discovery and exchange between you and your baby. Kathy Daggio, who has specialized in infant development, talks about the process.
You will learn a lot from your baby by how your baby behaves. And at first, you may not know exactly what to do or what your baby needs. But if you trust your instincts as a parent, you'll begin to slowly figure out exactly what your baby is needing and what he's saying. And babies communicate right from the very beginning through their little movements, through their facial expression, much as we as adults communicate back to babies by those very same things. And communication is really a dance. It's a rhythm that happens by parents and babies just learning to be together and be comfortable in what each other needs.
After your baby is born, the hospital will conduct a number of screenings. These will include a hearing screening. As a parent, it's important to know that even a mild hearing loss can affect a baby's speech and language development. If a baby can't hear speech sounds, he or she may have difficulty learning to produce them. In order to identify a hearing loss early, newborn hearing screening has become a standard of care in many hospitals across the country. In preparation for statewide programs, nurses and other healthcare professionals have attended meetings, workshops, and have undergone training in each of their hospitals. The test or combination of tests that are used for a hearing screening are safe, accurate, and are usually done after the baby has been fed and is comfortable and asleep. Auditory brainstem response, ABR, and otoacoustic emissions are two of the most commonly used methods for screening the hearing of infants. With an otoacoustic emission screening, a soft click or combination of tones are presented by way of a small earplug called a probe, which is inserted into the ear canal. If the hearing is normal, the cells in the inner ear become excited by the incoming sound and produce energy that can actually be measured by a sensitive microphone housed within the probe. When using this test, the fit and positioning of the probe is critical. If the baby's ear doesn't pass, the person doing the screening will check the probe tip for any debris, replace the disposable tip if necessary, and retest. A clogged ear tip can prevent the sound from reaching the ear and result in an unnecessary referral. With an automated ABR screening, the baby's skin is prepared with a cleaner. The forehead, cheek or shoulder, and the back of the neck, just below the hairline, are wiped with a cleaner so that sensors, called electrodes, can be positioned on different parts of your baby's head. Equipment wires are then attached directly to the electrodes. An ear coupler is positioned over each ear, and once testing begins, a very soft clicking sound is introduced to your baby's ear. The equipment then starts to collect and average electrical impulses that travel from the inner part of your baby's ear to the brain. The averaged activity is then automatically compared with a template housed within the computer to determine if the ear has passed the screening. Because your baby's ear canals are very flexible, if the ear doesn't pass the screening, the ear coupler will be removed, and the person doing the screening will gently pull back on the ear to open the ear canal. The ear coupler will then be repositioned and testing repeated. Although most hearing screenings are conducted in the hospital's nursery, there are times when testing is done in the parent's room or while the baby is held in a parent's arms. Terry Donovan is a registered nurse who oversees an infant hearing screening program. Terry comments on the hospital's screening protocol.
Typically for the well newborns in the newborn nursery, the screening is done as close to discharge as possible. And the reason for that is that babies, when they're first born, may have fluid in their ears. They may have vernix, which is the cheesy covering that is on the baby's skin, which may be in the ears and may actually block the signal that's going into the baby's ears. And what happens in that situation is then we then have to retest the baby. So the closer to discharge as possible is when we would do that screen. For babies in the NICU, we need to wait until they're at least 34 or 35 weeks gestational age. And again, that is really dependent upon what is happening with the babies themselves.
Once your baby's hearing screening is complete, you will be informed of the results before hospital discharge. The terms pass or refer are used to describe screening results for each ear. Because the sound that's used for a screening is very soft, if a baby passes, the hearing is considered to be adequate for the development of speech. If a baby refers in one or both ears, an appointment should be made for further evaluation.
We will communicate from the hospital to the pediatricians by letter or by telephone if this is something that needs to be taken care of in the relatively near future, to make sure that they get that information as soon as possible so that we can develop a plan for the baby and the family prior to the baby's leaving the hospital.
Shortly after birth, a doctor will examine your baby's face for any unusual signs that might be associated with hearing loss. The doctor will look at how your baby's eyes and ears are set, how the external ears are formed, and how the mouth has developed. It's helpful to know your healthcare provider in advance, so if your baby requires further evaluation, that person can assist you in the follow-up process. Your baby's provider may be a nurse practitioner, family doctor, or a pediatrician, like Dr. Mark Greenstein.
Pediatricians are involved not just in children who are ill, but also in helping children develop normally. It's one of the major roles that pediatricians fulfill. We do what's called well child care, and that includes things that people are quite used to, such as immunizations, screening in terms of how a child is developing, but also what's called anticipatory guidance. That means preparing you for the next step your child may take.
Although it's always reassuring when a baby passes the hearing screening, it's important to report any changes in your child's hearing behavior or speech development to your community health care provider. Some babies who pass the initial hearing screening do go on to develop a hearing loss, which can affect their ability to learn language.
Want to go Dada? In terms of sound production, even early on, we expect babies to begin to coo starting at around 2 months of age. That's an open mouth sound, sort of an ah, whoo, that babies will do often on their own in their cribs or often back to their parents. They begin to make more and more sounds as they get more and more used to using their mouths. And what's interesting is this parallels their feeding. And as they're ready to begin to start foods where they have to close their lips, they begin making sounds that require them to close the lips in the same way. Those are the ba, 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 ma, ma, ma sounds that they do over and over again. After this, babies begin making more complicated sounds, what sounds like a foreign language, and they're usually a little older by then. Even at this time, babies will understand often simple words that their parents are using, and if they're children who are not hearing well, they'll understand signs or facial expressions. In fact, just as an aside, children who don't hear well but who are being signed to or are looking at the world basically using their eyes rather than listening to the world using their ears do things even a little earlier. As a simple rule of thumb, one that we don't use to make too firm, we can say that for each year of age, you start adding a word to each phrase that you use. So 1-year-olds use single-word phrases, 2-year-olds use 2-word phrases, like mommy cookie, daddy car, or maybe daddy cookie, mommy car. By the age of 3, children are using 3-word phrases. Daddy car now, mommy me up. And by the age of 4, almost all children are talking in full sentences.
If your baby has recurrent ear infections or illnesses that are accompanied by a high fever, it can also affect your child's hearing. Talk to your healthcare provider about making a referral for a hearing test if you have any worries about how your child hears.
One of the important things that parents should do when talking to their pediatrician is to really communicate effectively their concerns and worries. I think this is important, especially so the pediatrician can fulfill their role as an advocate for the parents. It's very important then that your pediatrician is somebody who understands your concerns, and often they can call ahead to the doctor and arrange an appointment as soon as possible.
If your baby has been referred from a hospital hearing screening, it's important for your baby to be seen by a pediatric audiologist, who is a hearing specialist, within 2 to 4 weeks of completing the screening, to determine if your baby hears some sounds better than others, and if the problem is temporary or permanent. Although some hearing problems can be medically or surgically treated, there are others that do require the use of hearing aids and early intervention services. Your healthcare provider can give you a list of locations, including clinics and hospitals, which have the equipment to test the hearing of infants and young babies. Testing should be done by a pediatric audiologist who is skilled at testing infants, interpreting results, and in using a variety of techniques to keep a child interested as the child grows older.
Wonderful.
Christina Gonzalez, whose infant son was identified with a significant hearing loss, talks about the importance of follow-up testing after the initial hearing screening.
We wanted to choose a hospital that we knew would specialize in children, that had an audiologist and an ENT, which is an ear, nose, and throat doctor, that would also specialize in children. So once we found a hospital like that, we did call to make an appointment. Again, it's very important to seek that medical attention that you need for your child and the doctors that you need to find out, to see, and get as much information as you can if your child is born with hearing loss. And they told me to bring as many things as I could to comfort him. I brought 4 blankets from home. I brought 2 of his favorite pacifiers, and I brought myself, of course, and I brought a support system with me. I thought that's very important to bring. Unfortunately, my husband could not come with us since I'm not working. He has to work, and I brought my mom, which is the next best thing. You have to bring diapers to change him. You have to keep him as comfortable and quiet as possibly can, and he was fast asleep. I don't even think he knew where he was, as long as Mommy was right there. And then the audiologist sat down and explained to us the results of Nathan's test, showed us the graphs. I would say I feel very fortunate that Nathan had a newborn screening. I do feel that it's helped us as a family. We've accepted Nathan's hearing loss, and I'm very fortunate that at 4 weeks of age, after seeing an ENT, after seeing a child audiologist, they did place hearing aids on my child at 4 weeks of age. And I know that I'm very lucky for that Nathan can hear with us. One of the things I learned that it's very important to communicate with your child as much as possible, even with a hearing loss.
Talking, singing, reading, and signing are all ways to help your baby develop language skills. Your baby will quickly learn that by looking at you, you are communicating. Reading to children is so important that some hospitals are now providing parents with a book for their baby before leaving the hospital. As you prepare for the birth of your baby, become familiar with hospital hearing screening programs during childbirth classes, hospital tours, or prenatal care visits with your doctor or midwife. It's also helpful for you to know your healthcare provider before your baby is born, so the provider can help you find any other services and programs your baby may need. That way, you can enjoy the birth of your baby, knowing that professional services and parent support are just a phone call away. The language of love is communicated in many ways. Give your baby every opportunity to communicate with greater ease by identifying a hearing problem early. Early identification and intervention before a baby is 6 months old can lead to the development of age-appropriate language skills, similar to those of children who don't have a hearing loss. Remember, hearing can be tested at any age. The best reason to have a child's hearing checked is a parent's concern.